Good morning, everyone. Welcome. So we're going to go ahead and get started. My name is Cynthia Castillo, and I'm from the Cancer Treatment Centers of America. And, today our presentation is Health Insurance, Know Your Rights and Options. And it is my pleasure to introduce Ms. Deborah Wolf. And Ms. Wolf is a supervising attorney for Legal Health, a division of the New York Legal Assistance Group, where she works primarily with clients who have cancer. And Ms. Wolf specializes in disability law and has counseled or represented clients in various legal matters, including disability leave, insurance disputes, estate planning, and employment concerns. So please join me in welcoming Ms. Wolf.
Thank you. I'm very happy to be here. This is a huge subject area for an hour presentation, but we also want to make sure we leave half the session for questions. So I'm going to go through a lot of information fairly quick, but there will be time for questions afterwards. I'm going to talk about access to and maintaining medical coverage, the Affordable Care Act, which again, could be the subject alone of probably at least an hour presentation. Talk a little bit about coverage options, leaving work and keeping your health insurance, and then finally appealing claim denials. And I know in the last session that I did, there were comments that came up about appealing claim denials, so I know it's something that a lot of us have had to go through. So I want to talk first about medical coverage overview. Because I'm going to be talking both about private coverage and government-based coverage. Private coverage is, it could be a group policy that you have through employment or possibly through a union. An individually purchased policy, which is a policy that you can buy on the open market. And then now most of the states are now all offering marketplaces where you can go on your state website and take a look at policies that are available through the Affordable Care Act marketplace. And then I'll talk a little bit about government-based coverage as well, Medicaid and Medicare. And one thing I want to mention in terms of access to insurance is, with private coverage, some people do have policies through work, and group policies are less expensive. For people that are self-employed, check out organizations in your area that might offer group insurance. When I first moved to New York, I actually got policy through a women's writing guild. I have a sister who's a social worker, and she has a policy through her social work agency. So even if you're self-employed, there may be group policies that are available to you, and usually they have pretty extensive coverage. And the premiums are less than policies that you'll buy on the open market. I can't speak for every state, but I know in New York to go onto the insurance department website and get insurance, it's going to cost at least $1,000 a month, so the premiums are really crazy. So with employer-provided health insurance, there are two laws that govern and two laws that are important, and one is HIPAA. And everybody's probably familiar with HIPAA because it's our privacy law. And when you go to the doctor, you sign your name, they immediately cross out your name or cover it up, and you have to sign all those HIPAA privacy forms. But HIPAA also has another section that prevents health insurance coverage for workers. And we'll talk about that in a minute. And also a law called ERISA, which is the federal law that governs employee benefits, and it sets minimum standards and provides protection for employee benefits, although as we talk a little more, you'll see that sometimes ERISA really does benefit the health insurance company as opposed to the employee. So first, with respect to group coverage, and this would include policies through work, this would include groups, as I mentioned, for people that are self-employed. Even before the Affordable Care Act, group health plans can't establish rules of eligibility. They can't choose who they're going to cover. If you get a new job, you have the absolute right to that health insurance, even with a cancer diagnosis. They can't charge you a different premium. Everybody has equal access to that group policy. And then I mentioned if somebody's self-employed, you can check with unions or organizations to see if there's policies available. And then individual policies can be purchased through brokers. But with respect to group policies, there's no separate rules of eligibility and no disparities in premium based on anybody's pre-existing condition. With the Affordable Care Act, there's a three-pronged approach to expanding coverage and reducing costs. One is the individual mandate and guaranteed issue that we will talk about, the employer mandate that I'm not going to talk about today, but also expanded Medicaid eligibility that I'll talk about. So with the Affordable Care Act and the expansion of insurance rights, insurers must sell and renew insurance, health insurance, regardless of health status. A person cannot be denied because they have a serious health condition, and they can't be charged additional premiums because they have a pre-existing condition. In the old days, insurers, they couldn't refuse to offer a policy to somebody because they had a pre-existing condition, but what they could do is say, we'll give you the health insurance policy, but if you have a pre-existing condition such as cancer, we don't have to cover that pre-existing condition for the first year. So that was a huge problem for anybody who needed new insurance and had a pre-existing condition. One of the benefits of this law that has really impacted people I work with is the new requirement that policies can't have caps on coverage. Before the Affordable Care Act, an insurance company could say, after we pay out $1 million, we're done. We're not going to pay any more claims. And for somebody who's in treatment or has a transplant or whatever the case may be, $1 million comes very quickly. And I had many clients who got letters saying, oh, you've reached your limit, you're no longer covered. After the law was passed, they got letters from their insurance companies saying, we're back in business and we're now going to cover your claims. So definite benefit with respect to no caps. And that's either annual caps or lifetime caps. Insurance plans can no longer stop coverage because someone gets sick. And although that didn't necessarily happen in the group plans as much, it did happen, and people would get letters saying, well, you've had this serious illness and we've paid out X amount of dollars and we're not going to renew your policy next year. No longer. And then the health plan marketplace is available in every state for comparison and enrollment. So under the Act, a health insurance marketplace, I should actually have updated this to say now operates in every state. I think I put this slide together before the Affordable Care Act actually was implemented. And it's one-shop stopping. You can go, you can look at plans, you can compare plans. There are a lot of subsidies that are available based on income for somebody who's lower income. The plans will cost less, and when you're on the website, it will tell you whether or not you qualify for any of these subsidies. And I know that there were a lot of enrollment issues when the marketplaces first rolled out the end of last year, but for the most part, those have been resolved. And I have talked to a lot of people who have gone onto the website, I'd say within the past few months, and they have said it's been a very easy website to navigate and to determine what plan will be best. And also to determine whether or not you might be eligible for Medicaid for those states, not every state has, but for those states that have expanded Medicaid, and I'll talk about that as well. So through the marketplace, these are the plans generally that are available, ranging from the bronze to the platinum. You'll see that even the best plan covers 90% of covered benefits. So I think people have to look at these to determine whether or not they're the best plans for them. Because if somebody's in active treatment for cancer, 10% can be a lot of money. So there really has to be a determination as to whether or not these are the best plans available for you. The law does say that for 2014, the maximum a person pays out of pocket is $6,350. Sounds like a lot of money, but if you've got a health insurance plan that has a subsidy, so you're only paying $100 or $200 a month, if you figure out, and the $6,350 divided by 12, it still can be less than a lot of plans that are available on the open market. So it's something that really has to be thought about and looked at in terms of whether or not this is best. And then the other thing is these plans act like HMOs, and I'm going to talk about that in a little bit. So you have to do a little bit of homework. You have to find out what doctors subscribe to these plans. If you are in treatment, you want to make sure that your particular doctors are members of these plans. I've had some complaints over the past few months from people I practice in New York City, from people who have one of these policies and can't find a doctor. In one case, I just talked to a woman who was trying to find a breast surgeon and was having the most difficult time finding somebody who took her plan. So it does take a little bit of homework before you sign up. For the out-of-pocket, I believe it does. I'll check on that, but I believe it does. All the plans, and this includes Medicaid and Medicare, require essential benefits, essential health benefits. Now this is, I just picked up this today, Friends of Care, and it's not an essential health benefit. It's actually a wonderful organization that provides referrals to me. So I'm not sure how they ended up here, but ignore that. But this is basically the essential health benefits that you're going to get in any plan. And that includes now Medicare and Medicaid. And talk a little bit more about some of the health benefits of the Affordable Care Act in a minute. So with the Medicaid expansion, as I've said, not every state has accepted the Medicaid expansion, which I have to say is it's too bad, because I work in New York, and a lot of my clients, for example, who are now on disability, collecting disability, or have reduced income, have now qualified for Medicaid, where they didn't before, and Medicaid is completely free insurance. Generally no co-pays for medical care, minimal co-pays for pharmacy coverage. And one of the benefits of Medicaid, and I work a lot with Medicaid because I have to help a lot of my clients who need home care benefits, and Medicaid is the one plan that has unlimited and expanded home care benefits. Again, coverage varies state to state. Eligibility varies state to state. But in New York, I mean, if somebody qualifies for home care 24 hours, 7 days a week, Medicaid will pay for it. Also, transportation. In New York and in many other states, Medicaid provides transportation for clients who might not be able to take public transportation to their appointments. In New York City, we don't have cars. I know in other states you do, but sometimes people need help with transportation. So Medicaid now is divided into two sections. One is called MAGI, or the Medicaid, the Modified Adjusted Gross Income. And I don't expect everybody to get this in a few minutes. It took me months to understand this, but basically MAGI is for people that are under 65 and not disabled, or if you are disabled, not with Medicare coverage. And in New York, I'll use that as an example. Before the change, a person was eligible for Medicaid if their income was under $721 a month. Now in New York, and I have to add a zero, it's $1,320. So a lot more people are eligible for basically free coverage as a result of the change in the law. And again, the rules regarding resources, or how much money you can have in the bank, vary state to state. New York doesn't care. If a person is earning under $1,321 a month, they can have $500,000 in the bank. They will get Medicaid. New York does not look at resources. Other states do have limits, so again, it's, you have to understand your particular state rules. For somebody who's over 65 and disabled, eligibility rules vary. The rules are a little bit more stringent for people that are older or disabled. To me, it doesn't make sense. It should be the other way around. People who are disabled or elderly should have better access to Medicaid coverage, but basically that's not the way it works. Maybe because of the concern that their claims are higher. So other things with the Affordable Care Act, just other provisions that I want to mention. No co-pays for preventive care. If you go see your primary care doctor for a checkup, you should not be charged a copay. It has to be free. Certain tests, mammograms, colonoscopies, no copays for anything that's preventive. Better access to appeals, and I'm going to talk about this at the end of our time. But the appeal process has definitely been improved. And not only that, but when somebody's appealing, you have the right to get a copy of your file. You have a right to say to the insurance company, I'm going to appeal the denial of my PET scan because you're saying it's not medically necessary. But before I do that, I want to see how you came to the decision. What did you rely on? Who reviewed my medical file and determined that this wasn't medically necessary? You have a right to all that information. And also the insurance company rules. I mean, they have specific rules and regulations about when something is deemed medically necessary, and you have access to all that information to write a better appeal. And then all states now have consumer assistance programs. These are organizations that are available to help you. If you have a problem with your insurance company, they'll help you appeal. If you have a question about the marketplace, they'll help you figure out the answers to your questions. The other thing is, and again, this varies state by state. New York has a terrific insurance department. Most states do. Our state attorney general's office has a division only for health insurance complaints. So check with other state offices that you have if you're having problems, because we can, I mean, in New York, we can appeal with the insurance company, but we can also file a complaint directly with the Department of Insurance, and they will investigate. And we've had cases where the Department of Insurance has jumped in and said, you can't do this. So Medicare. A lot of people call me and say, I want Medicare. How do I get Medicare? You only get Medicare under 3 circumstances. 1, you turn 65. 2, you were approved for Social Security disability and you've been collecting disability benefits for 2 years. Or 3, there are certain illnesses that qualify for Medicare. No cancer diagnosis. The only 2 that I know of are ALS and kidney disease, advanced kidney disease, the need for dialysis. Medicare consists of 4 parts. Part A, which is free medical coverage, which everybody gets when they turn 65. Or Part B, which is medical insurance, which requires a monthly premium, about $104 a month. I'll skip Part C for now. Part D is the prescription drug plan, that in which private companies contract with Medicare to provide prescription drugs. And then Part C are Medicare Advantage plans, which work like HMOs. They're companies that contract with Medicare to provide Medicare benefits. And they usually will encompass both B and D. So if you have a Part C plan, they'll pay your doctor costs, plus they will pay for your prescription drug costs. And there is a premium, but it varies depending on the plan that you choose. So with the Affordable Care Act, there have been some good changes in Medicaid and Medicare. Oops, I'm jumping the gun. So let me get to the next slide, let me mention a few other things. With Medicare, if you have Part B or Part A, they cover 80% of your costs. So you have the same problem here that you had with some of the policies on the marketplace, in that if you have a lot of medical bills, paying that 20% is a huge problem for a lot of people that I work with, and they can't pay their copays. There's a lot of copay assistance programs out there for people with cancer, but nothing that covers everything. There are supplemental gap policies that are available through different companies that will pick up that gap that Medicare doesn't pay. Everybody I talk to, I tell them, you can't have Medicare alone. You've got to have a gap policy. Medicaid, for people who qualify, can supplement Medicare. A person can have Medicare and Medicaid. And I should mention that a person can have private insurance and Medicaid in many states to pick up co-pays, et cetera, or home care that your private insurance won't pay for. One thing I do want to mention, though, is with these gap policies, again, with the Affordable Care Act, there's no longer any pre-existing condition exclusions, but that does not apply to gap policies. Though some of those gap policies have pre-existing condition exclusions, the Affordable Care Act does not apply to these policies, so you have to check and make sure that you'll be covered if you have a pre-existing condition. Affordable Care Act has preventive care benefits, just like with the other plans I mentioned. And one of the biggest problems with Medicare has been the donut hole. The prescription drug coverage was pretty horrendous for people because they paid a certain amount and then they stopped paying drug costs for a few $1,000s, and somebody had to pay that out of pocket, and it was a huge burden for people on Medicare. Donut hole is now being eliminated. I think it was eliminated 50% this year, and it's going to be incrementally decreased until 2020 when it's completely eliminated. And in the interim, while it's being decreased, there are caps on what drug companies can charge for prescriptions through Medicare. The costs of the drugs are controlled somewhat. Still expensive, but there are some controls. So I talked about this already with Medicare, no-cost screenings, Medicare coverage. I know there was a lot of talk before this law was implemented about it's going to do away with our Medicare. It actually was the opposite, and Medicare is protected until now, at least 2029, and I'm sure it'll be extended after that. So with private insurance, people call me all the time and ask about what do I do. I have some choices. Sometimes even through work, you have a choice of an HMO or a PPO. Every insurance company has something called a summary plan description. At the very least, you should read that. I always suggest that people get a full copy of their plan. I know it's tedious and not fun reading, but definitely worth it to go through it and find out what does my plan cover, what are the exclusions. It should have all of the information that you need to understand what's covered. Because even with the Affordable Care Act, though, for example, there's no caps on coverage, doesn't mean there can't be any limitations. And believe me, if they can have limitations, insurance companies will have them. So, for example, my husband's going through physical therapy right now. Our insurance policy says you can have a certain amount of physical therapy visits per year. That's okay. They can limit other types of treatment as well. So you really have to understand your policy. The summary plan description will give you the maximum payments, appeal guidelines, basically all the information that you need to know. So the three types of policies, and I'm going to go through these quickly, are HMOs, where basically it's health coverage with doctors that are under contract, and you have to go to an in-network doctor. They will not pay for any services out of network. The advantage of an HMO is that the costs are usually less. The premiums are usually less, and deductibles are usually less than if you go have a plan that allows out-of-network benefits. So if you're offered an HMO and all of your doctors subscribe to this HMO, it's not a bad idea to choose the HMO because it will keep your costs down. A lot of HMOs require a referral from your primary care doctor for specialty care, but not all of them do. Then there's the PPO, and the advantage of the PPO is that you can go to doctors who are outside the network. The PPOs have a network of preferred providers, and you will get better benefits in terms of whatever your co-payment is or co-insurance is if you choose a preferred provider, but you do have the freedom to go outside of your plan and see any doctor. Usually with a PPO, if you see a doctor out of network, the insurance company will pay you, and then you pay your doctor. And it's a higher cost share, so not as good coverage as with an HMO, but for somebody who has a doctor, I mean, there are some doctors who don't accept any insurance at this point, and you would have to choose the PPO to make sure that at least a portion of your medical visit is covered. And then there's a point of service. It's a little bit similar to the PPO in that you have a primary care doctor. They can make referrals out of network, but again, if you go out of network, it's going to be a higher cost share for you. It's going to cost you more money. So when you have a choice, usually your employer will offer you a plan description of all the benefits, information about what are your copays, what are your deductibles, how much they will pay for somebody in network, and how much they'll pay for somebody out of network. I talk to people sometimes who have issues because I talked to a woman the other day and her oncologist took one plan and her primary care doctor took another plan. None of them took the same plan, and I said, you have to make a choice. And you have to choose between your oncologist or your primary care doctor. Sometimes it's not an easy decision, but, not all doctors subscribe to the same plans, so sometimes we have to make choices. So if somebody is working and they have health insurance, I get calls all the time from people who are stopping work either because of their illness or for other reasons. Under COBRA, which is a federal law, applies equally to all 50 states to employers with 20 or more employees. You have the absolute right to keep your health insurance after your employment ends. The one exception is if you're terminated for bad behavior, stealing, fraud, something like that. You lose your right to COBRA, but assuming that's not going to happen, you have the right to keep your health insurance for 18 months. And that can be extended up to 29 months if you become eligible for Social Security disability. Another area where I suggest you check your state laws, because a lot of states have mini COBRA laws. In New York, for example, we have a law and people are entitled to COBRA if they work for a company with 2 or more employees, and we get COBRA for 3 years, 36 months. So make sure you know your state laws. And you get it at the group rate plus a small percentage, so it's oftentimes much more affordable than something you can get on the open market.
So it's 36 instead of 18 for New York?
And it's 36 months in New York for companies that are based in New York. So.
What if you live in a state but are insured by a different state? My husband works in North Dakota, but we live in Seattle. Which state law would apply?
Usually for COBRA purposes, it's the state where you work, because I can only speak for New York. For New York, I can say that it has to be issued or delivered in New York. So if somebody I had a client once who worked for Federal Express. We have a large office in New York, but their policies were not issued and or delivered to New York, so that this state law didn't apply. So, but it varies state to state. If you're on COBRA will end if you don't pay your premium or if the employer ceases to maintain group coverage. So I had worked with somebody recently whose former employer closed shop, didn't offer insurance. She lost her COBRA. If your employer changes insurance companies, you have the right to COBRA with the new company, even if you're not actively working. So you still get that 18 months of coverage. Or if you go to a new job and you get new coverage, then your COBRA will end. Or if somebody becomes eligible for Medicare. If you're on COBRA and you become eligible for Medicare, COBRA ends. If you're on Medicare, let's say you're working until you're 67, you have Medicare, then you become eligible for COBRA. You can have both if you need it. So complicated rules, but generally if you're on COBRA and then you become eligible for Medicare, you're going to get a letter from the insurance company saying, we're no longer covering you. I mentioned the COBRA extension for disability. If you leave work for health purposes and you become eligible for Social Security disability, you have the right to extend your COBRA for 29 months. You have to ask for this. They have deadlines. I have had cases where clients didn't know this, and we've tried to get them the COBRA extension even though we've missed that deadline. And a lot of times the insurance company, with the help of maybe an advocacy letter from the employer, have said yes, but they don't have to do it. It's really in their discretion. So something that's good to know in advance if anybody's on COBRA and disability. So appeals. I have found over the past couple of years, and I don't know if it's the Affordable Care Act or other reasons, but I have found less claim denials, but I know I've talked to a few people here who have not found that. But I found insurance companies actually behaving a little better than they have in the past. With the Affordable Care Act, you are entitled to specific information regarding why your claim is denied. They have to tell you how to appeal. Make sure that you read your explanation of benefits. If you get a denial, the first step is always to call the insurance company. Sometimes they just need more information from your doctor if it's a denial for medical necessity. I've had cases where the doctor's office wrote down the wrong claim, the wrong code for the diagnostic procedure. So call the insurance company first. Many of them will work with you to try and get the claim approved. You have the right, as I said before, to get a copy of your claim file. If it's something where you have time to do it, it's worth it. And one of the big changes, I'll get your question in 1 second. One of the big changes with the Affordable Care Act is now everybody has the right to an external review, and this is huge. In the old days, you appealed with the insurance company. Somebody working for the insurance company made the decision, so there really was a bit of a conflict of interest there. Now you have the right to go outside of the insurance company, have doctors that are not affiliated with the insurance company look everything over and determine whether or not the insurance company was correct or not. I can't speak for other states, but I was recently talking with an attorney in New York who just did a study and found that between the internal appeal process with the insurance company and external reviews, about 70% of reversals of denials were reversed, and that's a huge number. And as I said, also check in New York. We've got the insurance department, and we can file claims with them as well. So my motto is always, if you have the right to do it, do it. You know, if you have the right to file complaints with a couple of different organizations, do it. The insurance companies, I don't like insurance companies. They have to be pushed. They are, I feel like they sometimes will deny things that clearly should have been approved, and a lot of people are lucky they have somebody like me, or they have an advocate or a family member that can help them if people are going through treatment, if they've just had a transplant. This is the last thing that they want to deal with, and I think insurance companies sometimes rely on that in making decisions on certain claims. Watch your deadlines. As an attorney, I can't stress that enough. The deadlines vary. If you have a policy through work, you have a pretty generous appeal time, 180 days. If you have Medicare, it's usually 60 days. You have to meet those deadlines, because if you miss them, you may lose your chance to get the benefit that you're entitled to. We talked about the external review, and I just want to mention that if it's something that's an emergency, it can be expedited. And you have my contact information, so if people have questions, I'm always happy to answer questions. And I want to mention, I'll take your question in 1 second, I just want to mention that there is a National Cancer Legal Service Network. It's something that was started by my organization. I do free legal work for people with cancer. There are a lot of people across the country who do this type of work. The website is nclsn.org. You can plug in your website, try and find an attorney in your area that will help you. You can always email me if you're, or call me. I mean, you can call me if you're in or out of New York, but I'm happy to help you try and find referrals in your area. But, with health insurance, unfortunately, we have to be on our toes, and we have to read everything. We have to read all the claims to make sure that we're getting the services that we're entitled to under our policy. I know you had a question, so.
I just was wondering, what would be the interest of the insurance company, or in my partner's case, it would be the Medicare supplement, in helping you get your disputed claim passed? Like, what's in it for them?
I think that, I'm talking a little bit about the bad behavior of insurance companies, but I have to say that I've had some really good experiences with them as well. I've had cases where clients missed deadlines, and we've still been able to advocate and get claims paid that should have been paid. And I think a lot of times when you're talking with representatives at the insurance company, they want to do the right thing. They want to pay claims that should be paid. They will give you specific information as to why the claim was denied. And if it's something simple like, we just need some more medical records, they'll tell you that. So I don't want to paint a picture that everybody that works in the insurance industry is not there for you, because that's not true, but it's a mix. But definitely the first step is to call and try, and oftentimes they will work with you. And a lot of insurance companies have coordinated cancer services where they have a group that's dedicated to working with people with cancer and coordinating all their health care. So sometimes they're helpful.
Any exceptions to that?
There are some exceptions, as I mentioned, like the Medicare gap policies, but there are two exceptions for marketplace plans and for employer-based group coverage. The exceptions are they have grandfathered plans that were in existence before the Affordable Care Act was implemented. But there's not a lot of these out there. I have seen some, because if the plan alters or changes in any way, it's no longer considered grandfathered. So it has to be the same plan that existed. But these plans, they do change their coverage every year. So a lot of them lose their grandfathered. I think I've only in the past year only seen one grandfathered plan. So that would be the other exception. When they first implemented the Affordable Care Act, I said, I'm going to read it, I'm going to become an expert, I'll be able to answer all these questions. It's over 1,000 pages long, and I looked at that and I said, I think I'm going to have to rely on other people to read it and summarize it. So I'm still learning. It's a very complicated law.
But I think certain situations, for instance, I'm single, I'm in remission for AML, and I'm leaning towards getting it. And
I just recently read an article about long-term care insurance that talked about, first of all, they do have the right, this does not apply to long-term care insurance, so they have the right to deny coverage for pre-existing conditions.
They do?
Yes, they absolutely do. So just keep that in mind. But assuming that you are approved for a long-term care insurance, it's pricey. And I just recently read an article that compared the monthly cost of long-term insurance to somebody who actually needs nursing home care. And they said if you have an option for the long-term care insurance, take it, because when you look at what the cost of nursing home coverage is, even if you're paying a higher premium, it's worth it. The other option is, depending on where you live, I work with a lot of people who become eligible for Medicaid, because Medicaid will pay for long-term care insurance. There are things that you can do if you have excess income or assets to plan now for long-term care in the future. There are trusts you can use in different ways. You can be eligible to have Medicaid pay for long-term care as well. So case-by-case basis in terms of what someone's needs are, but I know when I've looked at expert opinions, they've said if you have the option of coverage, it's worth it.
Okay. And life insurance, I had a question. I have had life insurance and still do, but I turned 60 and it really went sky high as far as the premium went. My AML, is that going to be a consideration if I change to a different policy?
Yeah. It depends on where you live. Again, for example, in New York, that we have a law that says if you have a cancer diagnosis and you've been in remission for 3 years, you can't be denied life insurance. So if you have a state New York has very generous consumer laws. Mm-hmm. So understand your state laws. Without that, I'm sure the insurance companies would not give life insurance. So the answer is it probably will be a problem, except that there are these policies that are called guaranteed issue. You probably, in the old days, saw Ed McMahon. I don't know who's doing it now, but, no medical questions asked. Some of them are not bad policies, and some of them have premiums that are affordable. So you might want to look at those and compare those to what you have now. Most of them allow only for up to $10,000 or $20,000 worth of coverage, but you can get more than one policy if you feel that you need more coverage. So it's worth doing a little bit of homework, because my guess is if your state doesn't have a law like New York, they're not going to give you life insurance based on your history.
Okay, so that's up to me to do the research on all this at this point. Okay, thank you.
And you have my contact information,
Yes,
even though
thank
you're not in New York. If you have any questions, I'm happy to. I don't know about New Jersey. New Jersey has really good laws, too. And the other thing I want to mention real quick, since somebody brought it up, is if you are working, and this is true in almost all states, and you have life insurance through work, and you leave work for any reason, whether you take a medical leave, you quit, you turn 65, whatever the case may be, you have the absolute right to convert your group life insurance into a single policy. Avoid the problems that you might have with pre-existing conditions. No medical questions asked. You have the absolute right to keep your life insurance policy. Employers are supposed to, but they don't tell you this, and you only have 31 days to convert from group to life. So just something good to know for those of you who are working, at some point if you decide to stop working. Go ahead. Sorry.
My question is about the Affordable Care Act and the different levels of coverage. I'm wondering if the different levels include different pharmacy formularies and how patients can best go about figuring out what makes the most sense for them. Sometimes patients need to be on immune suppressing medications for a long period of time, and if that's not covered, that would be really a really expensive out-of-pocket cost.
So with the Affordable Care Act policies, they are run by, or administered, I should say, by insurance companies. So in New York, if you want, let's say, the Platinum Plan, you can choose from a number of different insurance companies, HMOs. Different doctors subscribe to those policies, and they probably have different formularies as to, their coverage. So you do have to check the policy, because there are different options available with respect to both the health coverage and the prescription coverage. So you want to do your homework in advance. I've talked to some people who were not given the best information at the very beginning. I think there was a lot of confusion about these plans and what they offered. So it's probably good to talk to a few different people before you make a decision. Don't just call the Consumer Assistance Program, because they in the past, I know, have given out some information that wasn't entirely correct. So it's worth looking it over yourself, too, and not just relying on other people.
Can an insurance company make all of a specialty out of network? So, such as your transplant doctors, can they make everybody in your state an out-of-network provider, or do they need to provide one in-network provider? Not that I'm choosing one doctor over another, but all of the pediatric transplant doctors in my state and the surrounding states are all considered out-of-network providers.
So you're talking not about the drugs, but about the actual medical
medical care that I'm trying to get for my son.
I know with HMOs.
It's a PPO plan.
Or that there has to be for every specialty, and you're not in New York.
No, I'm in Washington State.
Some of this is also governed by state law as well. There has to be somebody, a specialist in network. That's my understanding.
Okay.
That if they either have to provide somebody in network, or they have to pay out of network at the in network rates.
Okay.
It's my understanding. Most policies I've read have said something to that, so it's important to look at the policy.
Okay.
But it's my understanding, the problem is sometimes you'll call the insurance company and they'll say, oh, we have an expert, 33 miles away, or we have somebody in network, that's not really accessible.
And when I called the insurance company, they couldn't find anybody in Washington State or Oregon or Idaho or Montana, like nobody in that does pediatric transplant. But we'll pay for it, but it's a $15,000 a year copay that you have to come up with first. And it's like, well, that doesn't work. It's not that I'm choosing one doctor over another. I'm just trying to get care in the beginning.
It's my understanding, and I would push on that, and also check your state laws, because a lot of insurance companies are regulated by state, and I know New York has very good consumer laws that they have to find somebody in-network for you if they offer in-network benefits.
Okay, thank you.
My partner has T-cell lymphoma, and he went through a clinical trial at Hackensack, and it worked well and got in remission. And then he had an auto stem cell, and then that hasn't worked so well, and the cancer came back. So now his doctors are saying that he needs an allo, and they have not started the process because they think that he has traditional Medicare, that Medicare is going to deny it. So, so I've been talking to a lot of people and looking up Medicare's website and talking to the insurance people at the hospital. And I guess what I wanted to know, I guess I can ask you privately for recommendations of doctors of lawyers in New Jersey who deal with Medicare complaints for allos for lymphoma. Because it's one of those silent things. It's like the Medicare doesn't say they do provide it, and it doesn't say they don't. And it says that what it says on the website is for everything that's not mentioned as yes or no, it's up to the MAC, the medical, administrator, contractor.
But they haven't denied it yet, right?
No, they haven't, but they haven't submitted it because, from my understanding, 10 years ago they denied it, or the person they talked to approved it, and then Medicare never paid up. So.
Okay.
So they're reluctant to put it through, but I think I'm convincing them to put it through. But I guess what I want to know is, what is the experience you've had with claims? I guess I want to know both in terms of the HMO Advantage plans, but especially in terms of the traditional Medicare plans. Like, if they do deny it, what is your experience or anything you've heard about New Jersey? But also I'm interested in New York. In terms of fighting with those MACs to get it. Has it ever been won?
The truth is I haven't had a lot of Medicare appeals because I've had, pretty good success with Medicare. Medicare appeals are difficult. The way they work them, they don't it works different than private insurance. But somebody here might have had some experience.
Well, no, and I don't want to hear that they don't cover it. I want to look at it like a lawyer and never accept no and fight it and find out who they didn't cover it for, when they didn't cover it. From what I understand, Medicaid covers it.
Yeah.
Which is weird,
Yeah.
Medicare doesn't, but Medicaid does.
And access to Medicaid in New Jersey is much more difficult than New York. In New York, I would sit with that person and say, we'll get you eligible for Medicaid to pay that, but it's not the...
And you have to spend all your money down?
No, not in New York, and it's different in New Jersey, though.
I think that's what they do, but it's worth asking.
Secondary is try switching your secondary to somebody who doesn't go strictly by Medicare.
So they've been great at everything, and it's also been suggested that we switch to an Advantage plan, but then we couldn't ever use Mount Sinai or any of the other, or Sloan Kettering or any of the ones in New York. So I'm hoping that you have some New Jersey lawyers to recommend. Well, best case would be getting regular Medicare to pay for it and doing the LO at Hackensack. It's been good for us so far.
I know an attorney in New Jersey that does similar work to what I do, and she works for legal services, so she can only take people that are very low income, but she knows she has a really good resource network. So email me. My email's on the end of the PowerPoint there, and I'm happy to see what suggestions she has for New Jersey.
Okay, thank you.
Treated at Sinai?
Well, thank you.
Well, thank you so much,
Thank
Ms.
you.
Deborah.
It was nice. Thank you.